Good afternoon. My name is Lindsay. I'm going to be your student nurse today. How are you doing? You doing good? Can I go ahead and get your name and date of birth for me? Kendrick Johnson, 2/14/1999. Can you say that back to me? Awesome. Thank you. What brings you in today? A stool specimen? Okay, so the main reason we do our stool specimen is to indicate that there's no occult blood, to indicate for colon cancer, gastric irritation, any intestinal irritation, and any localized gastric pain. Okay, and this is going to be a clean procedure, and we're going to make sure that there's no parasites or ova in there, okay? Do you have any questions for me? No? All right, thank you. I'll be right back. Okay, Mr. Johnson, so just a little patient preparation. Whenever you're ready to do the specimen testing for us, we'll just come get us anytime. It's no rush. It's just whenever you feel ready, okay? You comfortable with that? Okay, great. Also, I was going to see, can you tell me when your last bowel movement was? It was 2 days ago? Okay, well, in your family, or have you ever had a history of any GI bleeding? No? What about a history of colon cancer? No? Okay, what about hemorrhoids or colitis? No? Okay, have you ever traveled out of the country or eaten any raw meat recently? You haven't? Okay, because we're just making sure eating raw meat could have, parasites, and we're just making sure. One last question. Have you recently taken any stool softeners or any anti-diarrheals? You have not. Okay, great. That will conclude this little portion. Whenever I come back, I'll have some more questions for you and some more patient education, okay? All right. So another way that we can make this quick and comfortable is we're going to provide you with quick and straightforward instructions. We want to provide the most private way for you and us to do this specimen culture. If you do at all feel embarrassed, we will definitely give you the clear instructions and you can do it yourself. But most of all, we want you to feel comfortable and we want you to feel like you have the most privacy that you can have. Okay, so just some teaching before we get started. There are two things that could happen. We could get a false positive and a false negative. A false negative is if you've had any vitamin C recently or you're a regular user of vitamin C. Are you? No? Okay, well, a false positive could be if you've eaten any red meats lately, any green leafy vegetables, if you take aspirin, incense. Yeah, did you take any aspirin? Or iron? Do you take any iron? No? Okay, well, one quick thing. After you're done, I will leave this cup for you, and so whenever you're ready, you'll just tell us, and we'll go from there, okay? Well, after you're done, you're going to use these cleansing wipes, these cleansing chloride towelettes, and you're going to wipe front to back. And also, one last thing is, just to maintain we don't want a false positive or false negative. When you do your bowel movement and we collect your specimen, make sure that there's no towelettes or anything that's inside the urine or kind of got caught, okay? All right, well, I'm going to leave these here for you, and you can just let us know when you're ready, okay? All right.
Now that we have the stool specimen, what we're going to do first is you're going to do hand hygiene, put on gloves, and you're going to twist this off.
If anybody needs
and dispose of this according to hospital policy, put it in the biohazard bag, okay? And now that you have your stool specimen, you're going to put the lid on and seal it tight, and you are going to label it with the patient's name, date of birth, the type of specimen you collected, your initials, the day that you collected it, and the time, and what type of test that this is supposed to be for. So with your stool specimen, you're going to open the lid, and then with your heme occult, this is what you're going to use. And before you open it, you're going to check to make sure it's not expired, along with the dropper that you're going to use. And it is not expired. So the first thing you're going to do is you're going to open this first flap. And when you open it, you're going to see two sections. So with the wooden applicator, you're going to take one piece of the stool specimen and you are going to apply it on section A. Okay, apply it there, and then you would dispose of this according to hospital policy. And then you're going to get another piece of the stool specimen, but you're going to get it at a different place because you want to see if there's going to be blood located all over the specimen or if it's just only a specific area. So you want to make sure and rule out it's not an upper GI bleed and smear it on section B. Okay, and then same thing, dispose of it according to hospital policy. You're going to wrap it up and then put it in the biohazard bag, just like that. Now you're going to close this, and then you're going to flip it, and you're going to open the back. Okay, and with the dropper, you're going to open it and add a couple of drops on the back. And if the paper turns blue, that means it is positive for blood in the stool. And if it doesn't change any colors, then the test is negative. And you wait to read after 30 to 60 seconds after you put the drops. And after you find the results, you are going to write it down in the patient's medical health record. And if it's positive, you notify the physician. And to dispose of your specimen, you're going to put it in the biohazard bag and dispose of it according to hospital policy. Okay, so if this test was tested positive, we're going to have to run some extra labs such as the platelet count, the H&H, your bun and creatinine, and your red blood cells, and your INO to determine to see why the test was positive. And another thing you can do to determine if there is actually something wrong with the GI tract, you can also put the patient on a no red meat diet to see if that's the reason why this was a false positive. And the way to dispose of it, so you're going to wrap the wooden applicators in here, and then you're going to have your heme occult test. You're also going to wrap in here. And then you're going to have your towel. And you're going to dispose of the towel in the soil linens or according to hospital policy. And then you're going to take your gloves over like that and perform hand hygiene. Okay, some ways to control infection from not happening is make sure you perform hand hygiene. That'll help reduce the spread of contamination and of the feces. Another thing is having clean gloves. Before and after you deal with feces, make sure you change gloves often because they may get soiled. Another thing to do is discard everything according to hospital policy because this is technically a fluid or an item from the body, so you have to dispose of it biohazardly or, like I just said, according to hospital policy. And if you're using this slide test, you need to use 2 different wood applicators so you are able to determine if the bleeding is in one part of the body or 2 parts. And if you use the same applicator whenever you're trying to get 2 different spots of the feces, you're going to contaminate both of them and it's going to make a false positive or a false negative on the results.